already. What are some of those more common myths that you address in the book? And maybe what are the ones that are most predominant, maybe, or maybe the most challenging to kind of convert people to be at least entertaining the thought of thinking differently?
Well, I think one of the myths that is so fundamental is to realize that low back pain is not a diagnosis.
Hmm.
It's a symptom for which we need to find a diagnosis. But when you look at low back pain clinical guideline, I mean that's a guideline that's targeting a symptom. That's like what's the best treatment for chest pain? Or let's have a guideline for chest pain. Well, we don't do that. We don't have a guideline for arm pain, but we do for back pain.
Yeah.
Because we don't know what else to call it. We're not good at diagnosing it. So we use low back pain as a surrogate for a diagnosis, but it isn't. It's only the symptom. And so the assessment has to shed some light on what's the cause of that symptom. So that's one of the myths, is that low back pain is the diagnosis, and of course it isn't. Another common one is that most people recover from low back pain within 90 days. Well, that's based on one study, and it's a flawed study, way back in the 60s, where patients that didn't return to their general practitioner for back care were considered recoveries. And so 90% of people that are considered recovered with back pain, regardless of what you do. Well, there's many reasons for not coming back to your doctor besides your recovery. One is, of course, you're not getting any better, so you're going to go look someplace else. So that's a big problem. So that's another myth.
Hear the entire episode for free on iTunes, Spotify, other favorite podcast players, or go to mechanicalcareforum.com.